This is Drumbone here, your intrepid reporter. Yes, indeed, I'm recording live. Well, not live exactly because no one's here. It's an empty Capitol, Congress. You remember Congress? All those women and men that dress up in funny suits and go and talk 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 and collect money, of course. Anyway, they're not here. They're on vacation. They left the health bill because they wanted more time to really consider it. Yeah. Anyway, it's interesting. When it came to killing people in war, they were hot on that, boy. They rushed right in there. They couldn't wait. They had to do it right away. Must be done. And they did it. And did it. And did it. They've dumped more money in war without even thinking about it. And then there's, of course, that old famous, oh my God, we have to bail out the banks. Emergency. My God, look, send them, wheelbarrow the money in. Just wheelbarrow the fucking money to them. Quick, we can't stop. We can't. Look, we have to do it now. Healthcare? Well, we want to get it right. So that's assuming, if that's true, then bailing out the banks and dumping money into war wasn't the right thing to do. Well, that's the way I interpret it anyway. Yeah, we have to get it right. That's why we want to take more time. So we go on vacation. That's a healthy attitude in my book. Go on vacation to get it right. Whoa, man. Can you imagine if every time to get it right they had to go on vacation? Wow. That'd be a long year. Well, we are lucky to have the opportunity here to talk to Senator Slipshod. He was one senator who was left behind. The other senators left on vacation, but Senator Slipshod remained behind, and we will be able to discuss why that is so, as well as much candid information about the healthcare process. So right after this message, we'll have that interview.
Welcome to United Health Corp Care. Press 1 for English. We care. Our bottom line before your bottom line. Your prime care physician will be Dr. Nickeldine.
Oh, I'm so sorry. This wallet is empty. Next patient, please.
With United Health Corp Care, you are a goner. Profit before people. We care. Thank you.
Well, the Capitol's empty. So I looked around for somebody, and I found Senator Slipshod here that is willing to be interviewed. Why are you in town? I mean, what happened?
Well, my mistress went off to Guatemala, and my wife is in France, and well, I'm all alone, and I thought I'd pick up a little. Do some work on the healthcare bill without the phones ringing. You know what I mean?
Whoa, Senator. What do you have to say about the fact that the first half of the year alone, this year, the healthcare industry lobbyists have spent $263.4 million to influence Congress?
Well, it's an age-old issue that comes up now and again, the influence of lobbyists and their money. Let me assure the American people that we in the Senate and the House are not at all influenced, I repeat, not at all influenced by lobbyist money. It just doesn't enter our minds. From time to time, it is true that we do take trips that are provided for by the health industry. These trips that we take are for investigative purposes to discover the new developments in healthcare that we can use to help the American people. I was at one just last year in Vegas, and I find my health has improved considerably. There's the sun tanning and anyway, sometimes we even gone to Disneyland, which is very similar to Washington, D.C. I see very little difference. And we work very hard and diligently with lobbyists, with the corporate interests, in order to provide the finest health care in the world to our public.
Now, the majority of Americans seem to be in favor of the single-payer health plan.
Well, that just can't happen. To have that happen, it would have to be on the table, and it is not there.
Even if the majority of Americans want the single-payer plan?
Any thinking person does not want the government running health care.
But, Senator, your health care is run by the government, isn't it?
It is true that the Senate and the House have full coverage health insurance for ourselves and our families. But like in any democracy, there are exceptions. Let me assure the American public that a corporate-run healthcare system is for us. I mean, for you.
Well, thank you, Senator Slipshod. Whoa, can you dig this? There are 3,300 Washington lobbyists working on health care, which means there are 6 lobbyists for each of the 535 members of the House and Senate. So, there is only one thing a member of Congress will truly respond to, and only one thing. Forget writing them. Forget town hall meetings. Forget all that shit. They don't care. Get out bundles of cash, large denomination, unmarked bills. Franklin's are good. The bigger the bundle, the more finely in tune your Congress's ear will be to your needs. So, dudes and dudesses, that's the way it works. Get real.